Whole body is regulated by the brain, and brain needs oxygen to perform, and that oxygen is carried by the blood. However, brain comprises only 2% of the body weight. It needs roughly 25% of the oxygen that comes in the system at resting stage. Remember, this percentage is of resting stage, not moving or exercising stage, because while exercising, the body muscles will use more oxygen than the resting stage oxygen. Then the percentage of the brain and body oxygen will vary according to the type of exercise. Brain needs a very strict regulation of the blood that is coming into the cerebral circulation, and that is mostly auto-regulated by the brain environment. The blood flow of the brain remains constant at the mean arterial pressure, that is 65 to 140 millimeter of Hg. That means the metabolites that produced by the brain activity regulate the concentration of blood that will come into the cerebral circulation, and sympathetic nerves play a very minor role. Carbon dioxide is very important local vasodilator, or you can say most important local vasodilator for the cerebral circulation. In normal physiological state, the brain flow is remarkably constant. It is due to two main features: vascular resistance of the brain arteries and basal tone of the parenchymal arteries. Vascular resistance is called the resistance of the arteries to increase blood flow, and the basal tone means the arteries are in the partially contracted state to resist the more flow of the blood. But when the activity of the brain increase in the particular area, in that area the carbon dioxide increases. And because the carbon dioxide is most important vasodilator, that dilates the vessels in that particular area, and blood flow of that area will increase without increasing the blood flow of the whole brain. Apart from carbon dioxide, some other metabolites are also vasodilators. As if when carbon dioxide increases, it also increases the blood pH. That's why H plus ions increase. H plus ions are their self vasodilators. Potassium ions also play a role in vasodilation. Repetitive action potentials increase potassium ions in local area, causing vasodilation. Another substance called adenosine also increases in the area where metabolic demand exceeds metabolic supply. Adenosine monophosphate, and it is also a vasodilator. That's how the cerebral circulation is regulated by the local metabolites rather than sympathetic system, so that the blood is only supplied to the area much needed rather than increased blood supply to whole brain, because neurons are very sensitive to very minute changes in blood and oxygen.